and welcome to the September 14th session of the Arizona Commerce Authority's Small Business Bootcamp. My name is Faith Ritchie, and I'm the Small Business Programs Manager here at the ACA, filling in for usual host, Robert Theobald. As always, before we start and dive into our content for today, we always like to give acknowledgement and thanks to our many community partners who have made this program possible.
Recording in progress.
If you are new to the Small Business Bootcamp, this program was designed to help prepare small businesses of less than 20 employees return from the COVID crisis stronger than ever. It is a statewide initiative supported by our many community partners statewide and also consists of a resource collective and content library. The Resource Collective is a collection of articles and guidance provided by our community partners to assist small businesses across the state. Whether you are looking on return guidance, business essentials, or marketing strategies, these text resources are available for you through our Resource Collective. In addition to the Resource Collective, we also have our content library. Our content library is a collection of all of our recorded sessions just as of today, and includes those additional resources provided in those live sessions. Whether this is your first time engaging with a topic or you're really wanting to revisit some of the topics that we've covered, you can do so by visiting our Small Business Bootcamp website. Additionally, for ongoing mitigation measures and resources as it relates to the COVID-19 crisis, you can always visit Arizona's ArizonaTogether.org and our Arizona Commerce Authority's COVID-19 website. We'd also like to take some time to remind those of you joining the call that the ACA has many programs available to our business community. From small business to workforce solutions and manufacturing extension partnership, the ACA has programs and resources available for all business industries across the state. In addition to those resources, if you are looking to start a business or expand in Arizona, we also recommend that you visit our small business checklist. This interactive and intuitive online resource assists with all of those frequently asked questions as it relates to licensing for local, state, and federal levels. Again, whether you are starting, operating, or growing, there is information on the Arizona Commerce Authority's website for you. Now let's jump into some small business updates. We have continuously reminded you all of these updates, and we will do so again today. For PPP loan forgiveness, we have shared some details and numbers about that, and many of our small businesses are still needing to apply for that forgiveness. Again, these links will be shared in the chat for more additional information, but we do want to remind you that forgiveness, to apply for forgiveness, is essential. Also, EIDL program funding is still available, as well as employee retention credit. We've recently done a bootcamp session over this topic, so we encourage you to check out that content library and to review that session to get more information and see if you are eligible to apply for that employee retention credit. Last but certainly not least, our small business development centers across the state of Arizona can provide great one-on-one assistance and resources to businesses of all sizes. And we always encourage our small businesses to reach out for that counseling. Now, looking ahead to our upcoming sessions. First, you'll see why we're all here today is Healthshare right for you and your team. But continuing with their 3-part series, we have welcomed back Financial Potion for our Thursday sessions on September 16th and the 23rd. Sneaking into next Tuesday, we're welcoming back the Sandler training, Mark Kirsten and Link Miller, to talk about sales strategies through the holiday season. It may seem early, but now is the perfect time to position your business for the holiday season. Now, again, why we are all here today, we are so thankful and excited to welcome Melissa Blatt, founder and CEO of Indie Pop. Thank you, Melissa, for being here. This is a great topic that we have not covered yet before. So without further ado, we'll go ahead and jump right into your presentation today. And I will go ahead and stop sharing my screen and turn the time over to you.
Thank you. Thank you, Faith. Good morning, everyone. Give me 1 second to share my screen, pull up my slides. And it didn't start at the beginning. We'll go all the way back. Okay, so I'm Melissa Blatt with Indie Pop, and if you haven't heard of a Healthshare before, we are going to do a deep dive into the health sharing world. And health sharing can be for individuals, families, and small businesses. So I'm just going to give you a little background of myself. A few years back, I left the corporate world to go out on my own to be a fractional business development person. So that meant I was kind of like an independent contractor. And this was me. This was what I looked like when I was trying to find affordable healthcare. And I was one of the people paying, or I was going to pay 3 times the rates, or I was going to go without healthcare. And I knew I wasn't alone. There's actually 57 million in this kind of population. And what I found was I just knew there had to be another way. So I did discover health sharing. And that's when I formed my company, Indie Pop, which stands for Independent Population. And I curated high value health shares. So I'm going to give you a little story of members, and due to HIPAA compliant, these are not their pictures, but this might resonate with you. This might be your family. Robert's an independent contractor, and his wife, Sarah, was laid off last year to COVID. And therefore they lost the family healthcare because she had healthcare through her company. And she was really worried that her kids might get injured, or that her or her husband might have a major medical incident. And typically with families, they're paying a premium $1,500 to $2,000 a month. And then we've seen deductibles range from $10,000 to $16,000. So that means if there was a medical incident, like their son needed a surgery, they might have to pay $16,000 for that surgery. Whereas in health sharing, you can already see that the monthly went down to $889. And for that same medical incident of perhaps a broken leg, they're going to be responsible for $1,000. And I'll get into the acronyms in a second of IUA and MRAs. So they're already saving $700 a month, which translates into over $7,000 for the entire year. So what is the difference? Well, with traditional insurance, you have deductibles and you have premiums. And the deductible is you're going to pay for your health services before the insurance is going to kick in. Whereas with the health share, you become a member of a community that shares the cost in your medical needs. And so they have different terms. So an IUA is an initial insurable amount, or you might see it as an MRA, member responsibility amount, or what I call it is, hey, it's your patient responsibility amount. This is the amount you're going to owe if a medical need occurs. And you're most likely going to see when you're exploring health shares is increments of 500 to 5,000. Now I have a helpful tip here. Beware, because if you see that $5,000 level, that means it could be up to 3 times in a year. So that means that same broken leg or appendectomy, that can run you $5,000 for that one incident, but then perhaps your wife has a concussion, she slips off a ladder, that could be another $5,000. So I never guide members of Indie Pop to go for that. In fact, we don't even offer that level. We offer the $1,000 level or $2,500 per medical incident. What I love about health sharing is the transparency. So let's take that emergency appendectomy. You never know when your appendix might burst and you end up in the ER in the middle of the night. You have no control over who those doctors are or your anesthesiologist. And you come to find out 30 days later when you receive the bill, your anesthesiologist was not in your network, which means maybe a $1,500 bill. And with that, you have to either fight it or you're going to have to pay that claim. With a health sharing, take that same appendectomy. It doesn't matter what hospital, what doctor, who's on call that night, because your medical or your patient responsibility is going to be $1,000 for that medical need. So it's very transparent in what you're going to owe. And that ranges from an appendectomy to an aneurysm to a heart attack or cancer. And just like in traditional insurance, you're going to see that, so your membership is kind of like your premium. So if you're offered that $5,000 MRA or IUA, you might see a lower monthly. I, again, guide people, if you're going to pay 15 to 70 or save 50 to 75 or even $100 a month just to have that $5,000 because that brings your monthly lower. I mean, you're taking a gamble because you might end up paying $15,000 in the year. So I usually advise people, again, away from that $5,000 level. And let's talk about the benefits of health sharing. So most health shares are going to leverage telehealth. And what they're doing there is basically saying, hey, this is come to us first and let's help you navigate care. So it might be called a care logistics team. It might be called a concierge team, or they might just say it's telehealth, but they're going to help kind of navigate or guide you, which is much different than traditional insurance. You're always going to start with a phone call to them, or you're going to use the app. And what they're trying to do is help you get the best care at the right cost and try to keep bills down to zero. With telehealth, we've discovered 1,500 different types of conditions that can be literally diagnosed by a virtual provider. And they have either an open network or a very large network called PHCS. It's a very large network, which you can even nominate your doctor to be part of. And that is going to offer a discount for your primary care or let's say a specialist. So an example, my dermatologist, a few years back, I had insurance that switched and now she's not in my network and I was really sad. So with insurance, they billed $260 for that visit. So I said to her, doc, if I just came to you and paid cash, how much would it cost? And she said 90. And I'm like, okay, done deal. I'm going to pay out of pocket. So a lot of times when you are in a health share, you're not really getting an ID card. You are going into a doctor as a self-pay patient, and you're definitely going to get a lower rate than what the insurance would bill. And so that brings me to the next point, which is lower monthly rates. So you're going to see lower rates for to move forward in being part of a health share. And then for major medical, for sure, you're going to see definitely lower than that $10,000 to $16,000 range. And lastly is fair medical pricing. So there is something actually called a blue book, and the blue book has prices from gallbladder removals to what it should cost for a biopsy, what it should cost for an x-ray by your zip code. So I had a member who lived in Brooklyn and she has to get an MRI every year actually. And she was getting quoted $1,900 for this MRI. And so in one of the health shares we used, we were able to price it out within a mile distance of her, 5 different facilities, and she saved $900. And we could tell what is the fair medical rate for this MRI in Brooklyn compared to Ahwatukee or Chandler. So let's go over some examples. Sprained ankles. So when you are with traditional insurance, most likely you're going to go to your primary care doctor or urgent care or the ER if it's, a really bad sprain and you're in a lot of pain. And ERs, we never know what that bill is going to be, but you'll have copays and deductibles. This health sharing is a different approach. So what you're going to do is you're going to call that telehealth, that concierge team, and literally that's from your bed or from your couch. And you're going to be put with a virtual provider who more likely will order an imaging for you, and you'll get the fair market price, or it'll be included in your Healthshare. And a few days later, they'll call you with the results. It might be fractured and they might prescribe a boot that you would pay $80 for. But the difference is that you kind of skip that whole ER and urgent care, or even waiting a few days to get into your primary care doctor. You were able to talk to someone pretty much right away. And then this leads me to the next example. So everyday care of like sore throats, rashes, pink eyes. Most likely you would go, call your doctor. You might have to wait, or you'd go to urgent care, especially if something's in the middle of the night and really bothering you, your only option is the ER. So with the Healthshare, it's really nice to have that 24/7 opportunity to be in touch with someone, to at least to get a second opinion of what you could be able to do in the meantime. Or for pink eye, they can actually prescribe a prescription for the eye drops. And then if you have a 24-hour pharmacy, you can go and pick it up in the middle of the night. Let's talk about emergency surgeries that are never planned for. Without healthcare, surgeries, especially like this appendectomy, that's an appendix removal, is between $10,000 to $35,000. And with that Healthshare, the same medical need, $1,000 to $2,500, depending on that IUA or the MRA. Helpful tip. I get asked this a lot. Okay, what if I'm having a heart attack? What if I cut my finger off? What if I see the bone sticking out of my body after I broke it? Okay, if it's life-threatening, you don't have to start with the Healthshare. You call 911, you get to the ER. As soon as you're stable, that's when you loop your Healthshare in. And I pulled this up because I think there's some valuable lessons here. This is a traditional healthcare insurance quote. And they base it off of earnings and age. The Healthshares that I work with do not go off of earnings. Some of them don't even have age bands, which means it's the same rate monthly, 26-year-old or 56-year-old. But what I thought was really interesting is this column over here, and you can see it's really teeny text. And so when I was reading this for myself, I'm like, okay, preventative care, $0. Wait, it says you pay. Okay, I pay $0 to go to my preventative care. But then look at the rest of it. Is primary care visits, I pay, specialist visits, I pay, mental health, I pay, physical therapy, I pay. So it dawned on me what was happening here is this was more of a catastrophic plan. For me, they quoted $8,000 deductible. And that was one of the catalysts for me actually starting my business, because I just said, what happens throughout the year? When I get sick, I'm still paying out of pocket. The other thing that I've learned over the course of the year is these subsidies. And I think there's definitely a place for traditional insurance, and some people need to stay with traditional insurance. But I just have learned, like a hairdresser, for instance, she made a certain amount last year. Due to COVID, she was shut down for 4 weeks. So when she applied for healthcare, she actually got a really nice subsidy. It was basically like $0 a month. It had a really high deductible, $12,000 for her and her daughter, and a very small network for her doctors. But, in her mind, she was thinking, well, wait, I'm saving money. She then found out if she goes from maybe that $60,000 to $80,000 for this coming year, they explained to her she will have to pay back her subsidy $650 a month. So she canceled her policy because she didn't want to be restricted with not being able to make the earnings that she wanted to make. Now, if you are on, you're going to be at $45,000 for the year, it might make a lot of sense. But I think this should be talked about a little bit more with these subsidies for traditional healthcare. So when I start guiding people and talking to people about, hey, is a Healthshare even right for you? Let's look at what you have with traditional insurance, what your copays are. Do you have coinsurance if something happens to you? Look what's included in your plan. Are your labs covered? Your ER visits? Do you have to reach your deductible before your ER visit is covered? What about primary care? And then what we do is we go over some of the bills that have happened in the last 3 years. Do you have a new condition? Are you being treated for something? Is it medically managed? Do you go to doctors regularly? And that's when we weigh out and say, I think traditional healthcare is really a better option for you. It's not going to be the best fit for everyone. Here's another helpful tip. When you're exploring health shares, there are health shares that do a reimbursement model, which means if you are in the hospital, you might have to lay out or pay a $10,000 or more bill and then wait to be reimbursed. I did not align myself with health shares that do that model. Again, if you're in the hospital, our model is you're going to pay $1,000 or $2,500 is your patient responsibility amount. And then again, with the IndyPub plans that I aligned with, they're all high value, which means, yes, they all have kind of a concierge or a care logistics team. They do have 24/7 telehealth. I have one plan that has unlimited primary care for yourself or for your little ones in person, not just virtually. There's discounted prescriptions. I have one plan that they'll even tell you which pharmacy has it cheaper. They all have mental health. A few plans have your preventive care, your annual wellness. A couple of plans have health savings accounts, and one plan has chiropractic care. Typical membership. So these are rates. Obviously, it varies by the health share that you're looking at. For IndyPub plans, they run between this. So an individual member can be paying $200 to $379, depending on the plan and what's included. A family can go up to $900. And I pulled together the top questions that I'm asked so that we can just go through this, and this might even answer some of the questions that you have right now, and there'll certainly be time to answer more questions. So what happens if I get a dreadful disease? Is there an annual limit? And IndyPub, I have chosen plans that there's no lifetime or annual limit. Please do your research for other health shares. There might be a cap at $250,000. That's not really helpful if you have an aneurysm or maybe perhaps cancer. So that's something to look out for. Just make a note. Is there a lifetime or annual cap? And yeah, because you're responsible for a set amount. People ask me this all the time. You mean I'm only responsible for $1,000 if I get cancer? Yes. And the interesting thing about health shares, if you, God forbid, do get cancer, is if your treatment goes 18 months, so that's over a calendar year, you don't have to pay that $1,000 again the following year because it's the same medical need that you're still being treated for. Can I see any doctor? So different plans, different health shares have different requirements. Again, I've mentioned there's the PHCS network, which you're welcome to go to a link and see if your providers are on there. I do have one plan that has open network for specialists, for primary care, for any doctor, any hospital. What if I broke my leg? How much would I owe? Again, depending on your plan, on IndyPub plan, $1,000 or $2,500 would be the responsible amount that you owe. If I'm having a heart attack, when do I loop in the health share? As I mentioned, get to the hospital, it's life-threatening, then loop in your health share. Okay, pre-existing conditions, how far do they look back? So most health shares are going to look back 12 to 24 months. And if it's medically managed, like high blood pressure, high cholesterol, asthma, type 2 diabetes, and you have not been in and out of the hospital for 12 to 24 months, it's not considered pre-existing. A side note, you can enter a health share with a pre-existing. The issue is what that pre-existing condition is, and the first year it will not be shareable. So I'll give you an example. You had a heart attack 6 months ago. If you enter a health share and you state you had a heart attack, you might have even had heart surgery. If you enter the ER with palpitations or you have to have another surgery on your heart, that is considered pre-existing. If you entered the hospital with a broken ankle, that's a different body part, that would be shareable with the community. But again, I would just recommend to that person that had the heart condition last year, wait another year before entering a health share. I think traditional insurance is the best way to go, because I would hate for you to end up in the ER and have a huge medical bill because it's not shareable. What else is included in a health share? And this can range. I mean, almost all of them that I've seen have the telehealth model, but ours include major medical and hospitalization, and you have to look what's important to you. Do you care about mental health? Do you want to be seen in person or virtually? Do you need a prescription program? Do you need a health savings account? Are you looking for discounts and perks? Different health shares offer different types of resources and benefits and services. And this is my contact info. And you can find me, Mel Blatt, at IndiePop and my website. So I'm going to open it up to questions because I'm sure there's got to be a few, right?
Thank you so much, Melissa. We do have one question in the Q&A, but if you do have questions that weren't on that FAQ that Melissa went through, please post those in the Q&A. We do have time to answer those questions, so we'd love to get you answers today. So you touched a little bit about this, Melissa, but in the Q&A, we have the question, do health shares cover naturopathic doctors and or chiropractic care?
So it's interesting, if you're here in Arizona, which I'm sure you are, there right in our backyard in Scottsdale, Arizona is a health share called Redirect Health that IndiePop is partnered with. And they have 12 chiropractic sessions that's included. And also on their staff, which I've used her, Dr. Hug, she's an MD and an ND. So I can call her for $0 and talk to her about, supplements like GABA or saw palmetto, and she can talk to me about that. And again, that's a virtual visit at $0.
Excellent, thank you.
Yeah.
Again, if you have questions, please post those in the Q&A. I guess the question that I have, Melissa, is what health shares I feel like are so overwhelming to those of us who don't understand. What is the biggest myth that you would like to bust about health shares?
That's a good question. Health sharing is not as mainstream. When I didn't hear about it 3 years ago, I didn't know anything about cost sharing. And every time I looked it up, it was through a Christian ministry. And that is because it was birthed through a congregation over 30 years ago that decided to share the cost in medical needs. And they became a nonprofit. And so you're going to see different health shares that pop up that are nonprofits that are like Christian sharing. And you just need to be careful about the wording because they use statement of beliefs, which tend to use the word God. And so I've aligned with health shares that just have ethical statements that an insurance company would use, that you're basically saying you're not going to do illicit drugs and jump off a roof. You're not going to drink and drive. You're going to basically not harm your body purposely. So is health sharing becoming popular? Absolutely. People, as they see with insurance, the rates go up 9 to 13% every year. You get less coverage. You might even get kicked out of the network that you've had forever and you love your doctor and they don't take that insurance anymore. So I have a lot of my members come because they're like, I want to see my own doctor. And they, with a health share, it's most likely they will be in that PHCS network and they can. Also, that deductible for families is getting ridiculously high. So you saw at the beginning of the slides that an average is $1,500 to $2,000, and for a family, it can drop drastically. I have members on plans for $675. I mean, that's a lot of money that you can put in a health savings account to have for orthodontic work, for your kids' braces, or just to have on hand. So.
Excellent. Thank you so much for that answer. Yeah. We have gotten some more questions in the Q&A. So we'll start with the first question submitted. Do you work with direct primary care offices, which typically extensively cover primary care needs, but do recommend patients sign up for a catastrophic type coverage since your primary care doctor can't handle everything?
So there's one plan that I have. It's called the IndiePop Essential on my website. And that is direct primary care, but it's virtual. So you can have the same doctor monthly. Let's say you've been treated for a thyroid condition or diabetes, and you just want to kind of check in and monitor besides talking to your doctor or endocrinologist. This can be another really great way to have a virtual primary care that's on hand that you can talk to. I don't have one in person yet. I am looking for direct primary care options where you can sign up for maybe a subscription model. So stay tuned for that. Yeah.
Excellent. A specific question, is Mayo in health share programs?
It does not matter which hospital you go to. That is the beauty of a health share, is it's also, get this, portable. So if you, most of my audience are self-employed, freelancing, and they can, they can get an Airbnb for 6 weeks and travel. It's in all 50 states. If you have a child out of college, or excuse me, out of state going to college, they can use it in any state. If you're traveling out of the country for a vacation, not living there, just vacationing, it's and you had an emergency, it will be shareable. So yes, if your closest hospital is the Mayo, you're having a heart attack, you're with a Healthshare, absolutely, you can go to the Mayo.
Excellent. Again, if you have questions, please post those in the Q&A. We at Small Business Services here at the ACA, we work with a lot of solopreneurs. What is kind of the biggest hurdle that you've encountered with solopreneurs who are looking for Healthshare options?
Well, if it's just for themselves, they're finding they're just getting killed with rates because you're not part of a company that you're sharing the risk factor, you know? So when you go and look for healthcare as a solo person or as a family, it's just crazy. It can be crazy rates and crazy deductibles. Hurdles is, I mean, really it's been price, it's the affordability. And then they might want to add to their team. And so then they have to wait till, you know, sometimes open enrollment, whereas with a Healthshare, it's open enrollment all year long. So you can come onto a Healthshare each month and we're enrolling for the upcoming month. So right now I'm enrolling for October 1st. So if in the spring you decide, okay, I'm done with my traditional insurance, I'm going to go onto a Healthshare, you don't have to wait. You can do, I think with your insurance, a 30-day cancellation, if I'm not mistaken, and you can come to a Healthshare.
Excellent. Thank you. Also, Melissa, if you could, would you post your email address or share that screen again? We do have some questions as far as work collaboration, so I want to make sure that they're able to reach out to you directly. But then also in the Q&A, are there Healthshares for dental coverage?
Yes, and I'm adding more, which I'm really excited about because lately in the last, just posting my email and
no problem. Thank you.
Multitasking. Okay. So yes, dental and vision all of a sudden in the last few months is such a hot topic, a priority that, so I do have a standalone product. It's on my site and it's like, you pay one yearly rate, or you can divide it up into months, but it's actually really low for like a single person. I think it's $68. And it's kind of like a Costco membership. It gives you access to a discount for their providers. So what you're getting is 20 to 50% off cleanings or crowns or whatever you need, but you have to use their providers. I am moving forward with one plan now. Hopefully in the next week, it will be up. It's one of the Indie Pop plans. It'll be the Indie Pop Essential. And that has a really great dental, $40 a month for individuals. I think it's, I got to look it up again. I think it's $100 for the family. And there's no deductibles for the basic. But if you needed, you know, a crown, I think it's a $50 deductible for the individual and $120 for the family. And what I loved about it is you can see any provider. So that hopefully they're just finalizing the back end for me. And then I'll put it on my website, but that's the Indie Pop Essential will have dental. That's an add-on. So it's just an add-on that you can have. Vision is like $10 a month. And I think $25 for a family. Yeah.
Excellent. Now, Michelle in the Q&A wants to know the flip side of the coin. And is there a downside to Healthshares?
Well, it's not right for everyone. And I never push and say, you have to do it. I am not here to sell Healthshares. I'm here to help guide you to make a good decision for your healthcare. I never want anyone to go into medical debt or a Healthshare is just not right for them. So yeah, I would say, you know, if you have a condition in the last 12 to 24 months, or you've been dealing with something, it might not be the best fit because for the first year, it's not shareable. The second year, it's shareable up to 25,000. So that's something that you need to consider.
Excellent. Thank you so much for that answer. Again, we still have some time. We've gotten some great questions in the Q&A and encourage you to post those while we still have the time. Also, Melissa has posted her email address in the chat. So for those of you who are seeking out additional information of how to get involved in Indie Pop, fantastic. You can contact her directly to get those answers.
And small teams, Healthshares are really great for small teams because you can actually mix and match two different Healthshares if you'd like. Because I like to say Healthshare is, or healthcare is not a one size fits all. So if you have two or more in your company and two want to go on one plan and two want to go on another, that can be arranged. Health sharing is becoming, or not health sharing, sorry, health savings account, HSAs are becoming really popular. So if you're not familiar with a health savings account, what it is you can put like $100 a month into a health savings account. It's not use it or lose it. It rolls over to the next year and it's pre-tax dollars, which is really great. And this could be really helpful then if you are the type of person, I see an acupuncturist. So if I use it, I can use it from my health savings account that I have, maybe from traditional insurance, I'm saving about $150 a month off the premium, saving more for my deductible. But if I just take that little bit of savings and put it in, then I have, extra healthcare money that I can use if I wanted to see a naturopath, or I have it saved up and ready to go.
Excellent.
Yeah.
Oh, got another question. Can Healthshare be used with Medicare?
So eligibility is 18 to 64. So once you hit 65, you're not eligible to be on a health share. At least my health shares. There might be a health share out there that are for 65 and up. I'm not aware of it. But I have several people in their late 60s that they were offered their Cobra for $900 a month, and they're on a health share for $319. So if you're fairly in good health, you might be on one or two medications, but you haven't had any, you weren't hospitalized for anything in the last couple of years or diagnosed with anything significant, it could very well be a really great alternative for you.
Fantastic.
Mm-hmm.
I'm going off of what you said earlier for small teams. Is there a team that's too large for Healthshare?
If it's over 50, I do have solutions, but I think the sweet spot is like that 5 to 15, where you're just getting killed with traditional health insurance. Every year it's going up, or you're just spending a lot of time answering insurance questions and you just don't want to be in insurance anymore. You want to focus on your business. Indie Pop then kind of is the go-to people, like, hey, we'll answer those. Is that mammogram included question? Do I get an ID card? Can I go to this doctor? Like, but all the health shares are really great because they have that 24/7 access. All the ones that Indie Pop has aligned with have had really stellar reviews. I have met with the executive team. I have contacts over there. I really did take the time to research dozens of plans to find high value plans that I would entrust with myself because I'm on one of them, or my family or friends. So you just have to do some due diligence and, and look for what is important for your budget and for your needs.
Fantastic. We're just getting tons of questions. So I'm so happy that everyone's getting those out. I did get a question in the chat box. So I'll go ahead and read it to you. In comparing health shares, is there a single location to compare, or is the person responsible to look at individual health share providers to compare options?
So like, is there a site that compares all of them? I'm not aware. Well, I did find a site that has different health shares, but they're mostly Christian ministry ones. So like Liberty, Medicare. That's why I created Indie Pop, because I'm like, all right, I'm going to curate top high value plans into one place so that it'll save you a lot of time and stress trying to research and trying to then do a side-by-side comparison. It's all there on the site that you can look. Does it have annual wellness? Does it have mental health? What's my annual, what is my incident fee if I, broke my ankle? So when you're researching, yes, I mean, you just might want to search the internet for health sharing or cost sharing and see I know the Christian ministry ones are going to pop up because they have the dollars to put for Google, like, and they've been around a while. One of my plans, the Indie Pop plan that I've partnered with, has amazing reviews. They're on track to have 100,000 members by the end of this year. So, and there's a basic plan. If you just want like the catastrophic, like basic for the what if moment, what if I break my ankle, or what if I need an emergency appendectomy, for a 26-year-old, it's $175 a month. I mean, that's really doable. And it has 24/7 telehealth. So that's like the bare bones basic to be part of a Healthshare, to just kind of have that peace of mind. Like, I won't go into medical debt if I break my leg or I need my gallbladder removed.
Yeah. Excellent. Thank you for clarifying the question and providing that answer. I appreciate it. Well, Melissa, we don't have any other questions listed. That's always a good sign. That means you provided all that information. For those of you on the line, as a reminder, today's session is recorded and will be shared on the Arizona Commerce Authority's Small Business Bootcamp website. So you can take all this information in again, and you can also contact Melissa if there are additional questions that you may think of after today's session.
Absolutely. Thank you for having me. And yeah, if anything comes up, you can find my info and everything will be posted. So you can always come back to it. Yeah. Okay. Thanks.
Excellent. Well, thank you so much, Melissa. This was just provided us so much information. I know we've gotten some kudos of your presentation in the chat and Q&A. So I know that those participating got a lot of great information out of it. Oh, sorry. I thought I had a question, but it wasn't. So for those of you, we hope you can return for Thursday's session as we continue with part 2 of Financial Potions video series. So again, Melissa, thank you so much for your time and energy this morning. It's a great way to start Tuesday and so informative. We hope everyone has a great rest of your day, and we hope to see you back on Thursday. Thanks for joining us. Have a great day.